Dr. Darvish here. I hope everybody's doing well. Welcome to October, and it is Breast Cancer Awareness Month. And so this is always one of my favorite times of the year, not only because of the weather out there and the beauty of the fall, but also because of the fact that it is breast cancer awareness, and we have so much education to do and so much to learn about breast cancer and prevention, early detection, therapies, treatments, adjunctive therapies. And so we're going to spend the next month of October every Thursday at 12:15 focusing on a different aspect of breast cancer. And so today we are discussing prevention and early detection. So I hope that everybody's hearing me. Dr. Marian is hopefully going to be joining us soon. She had a little emergency patient going on. So hopefully she will join us before the end of the session here. And I'm hoping everybody can join in with their questions and comments because this is really about you and for you. So jump in. Let me know if you have any questions. So breast cancer, we know, is the most common cancer amongst women in the world. And the United States of America tends to have the highest number of breast cancer cases. Typically, 1 in 8 women will have breast cancer in their lifetime. So think about it. 1 of your 8 friends will have breast cancer. Hello, Vandana. Glad you could make it. So 1 in 8 women will have breast cancer in their lifetime. And sadly, 1 in 39 women will die of breast cancer every year, especially here in the US. Globally, we also do see 1% of men getting breast cancer. And so it's not just for women, it's also for men. There is 250,000 new cases of breast cancer diagnosed every year in the US, and 40,000 deaths are attributed to breast cancer each year in the US. Now, there is a 90% 5-year survival rate when there is early detection and screening going on. So this session is really aimed at discussing early detection and screening and your risk factors that you may have that you can do something about. So even though cancer is something that is out of control oftentimes, we have the control to do so much to help reduce our risks and to help change this epidemic, really. So one of the risk factors is the fact that if you have estrogen dominance. Now, in the past few sessions, we have talked about estrogen dominance, which means that you have more estrogen than you do progesterone. Estrogen is very inflammatory, and it is a major risk factor for breast cancer, amongst other hormone-related cancers. Other factors that increase your risk are things like early menstruation. So if you start menstruating around age 8, 9, or 10, you're going to have a higher risk. Also, late menopause. So if you're going into menopause after 55, you're probably going to be at a higher risk. The whole idea is that any kind of situation that may increase the estrogen in the system for a prolonged period of time will increase the risk of breast cancer. Hormone replacement, birth control pills, again, will increase the risk of breast cancer because they're increasing the risk of estrogen dominance. Higher body fat. So obesity is one of the major factors for breast cancer. And think about fat tissue in our body. That's where estrogen is made, especially postmenopausally, and especially estrone, which is the E1, the toxic estrogens. So when we have higher body fat, we've got a higher inflammation as a result of the estrogen, amongst other issues. So getting that body fat is going to be important. Smokers obviously have higher risk. Night workers, ladies that work night shift, nurses, any kind of a night shift that you may be working, on a consistent basis, or even if you're doing, a few days here at night, a few days there during the daytime, it does increase your risk for breast cancer. And we'll go into some of these reasons in just a bit. Vitamin D deficiency. Vitamin D deficiency, and that's really common here in the Northwest just because we don't get enough sun and we don't get the proper angle of the sun rays to transform the vitamin D into the active form that our body needs. And so what the research has shown is that vitamin D deficiency can stop cancer growth and the spread of it. So those of you who do have breast cancer or have a history of breast cancer, it is vital that you get your vitamin D levels checked and addressed. Now, here's another interesting risk factor is, hello, Mona, is a higher income and higher socioeconomic population have a higher risk of breast cancer. And I will get into that in just a minute because it is linked to viruses, okay? So bottom line, though, is that you don't have to have a family history of breast cancer to get breast cancer. Majority of the women, 80% of women, have never, ever had a family history of breast cancer. Obviously, if you have a family history of breast cancer and you have this gene called the BRCA1 or the BRCA2 gene, it does increase your risk about 60% of developing cancer by the time age 70 hits. But it doesn't mean that it's going to happen. If you go back to some of the other lives we did on genetics, you'll see that epigenetics, the switch that turns these genes on, doesn't need to be activated. So we have the control to turn that gene on or to turn it off. So even if you have the BRCA1 gene, doesn't mean that you're going to end up with the breast cancer. So I've got a few comments coming in on Instagram. One of them is Vandana, who has a history or recently diagnosed breast cancer. And she says, she never had a family history of breast cancer. Me, unfortunately, I have never been diagnosed with breast cancer. We're going to knock on that wood. But I do have a significant history of breast cancer, colon cancer, uterine cancer throughout my whole immediate and extended family. And so that does put my system at risk. And so I'm always trying to keep a tab on this thing and make sure that I reduce my risks as possible. And, unfortunately, we do as much as we can, but you've heard of people who are on the perfect diet, perfect lifestyle, perfect this, perfect that, and they still ended up getting breast cancer. It's so complex, and we're just still at the very beginning of developing and understanding what breast cancer is and how it gets to that point where it culminates into this cancer. So let's talk really quickly about breast tissue. The breast tissue is mainly made up of fat and lobules or ducts that become part of the lymphatic system. So the way I like to think of it is that the breast tissue is the lymphatic system and the fat tissue. And we just talked about estrogen hanging around in the fats. And so when you've got lymphatic systems being toxic or blocked up, it's going to increase our risk for breast cancer. In fact, what they have found is that 75 to 90% of toxins in the breast tissue is drained through the lymphatic system right here under the arm. And this is one of the major reasons why females get breast cancer when there is a blockage in the lymphatic system. But what causes the blockage in the lymphatic system? That is a big question. And this is one of the things that we are constantly on the search for, trying to figure out. One of the things we know is various viruses. We know mold blocks up the lymphatic system. We know that heavy metals and chemicals also block up the lymphatic system. So we also know that infections hanging around in the jawbone can increase the risk of breast cancer. And that is because there's about 3 miles, think about it, 3 miles of lymph tissue throughout the whole mouth, your gums, your teeth. And when there's an infection that's hidden, whether it's in the jawbone or around the tooth or within the tooth, the lymphatic system has to work hard to clean that out. And when it's trying to clean that out, and if it's overloaded with these infections, it can be a big source of bogging down the lymphatic system that drains right into that breast. So a lot of times we see that there is an infection somewhere in the jawbone on the same side as the breast tumor that may have developed in many of these patients. So looking at the teeth is incredibly important, guys, girls. Look at the teeth, get your dental care done, and get that on track, because if there is any hidden infections and you don't know about it because you don't have pain, but there is an infection that's draining right into the lymphatic system, guess what? It's going to bog down that breast. So the advice, one of the questions is, what advice do you have for younger women regarding prevention? This is one of them, and I'll get to that even more, but this is one of them, to get healthy dental care. There is a number of research out there looking at the gums and the gum health and its risk to breast cancer, how it does increase it significantly, okay? So one of the other things is hair color, this hair color. In fact, in 2015, there was a Finnish study that looked at 6,500 women between the ages of 22 and 60. And what they found was that hair color was linked directly to increasing the risk of breast cancer. Since then, there's been studies proving that, and some not. But the bottom line has been that there is an increased breast cancer with dark hair color especially. There was another study that was done with 4,000 women in 2017, and they found that hair dye was related to an increased risk of estrogen receptor positive breast cancer, especially in Black women. And that in the Caucasian, there was an increased risk of estrogen receptor negative cases with the use of hair products, relaxants, perms, and all of those kind of treatments. So ladies, when you are getting your hair done, please look into the hair color, look into the chemicals that are being used, and try to get as organic, as clean of a hair product as possible in order to reduce your risk for breast cancer. There was another study in 2018 that looked at beauty and personal care products. And again, they found that frequent users had a significantly increased risk of breast cancer. And then just recently, in 2020, there was a study where they looked at 56 previous studies, and they kind of reviewed everything. And they concluded that 80% of the publications showed that there was a significant increase between environmental toxins like BCPs and indoor cooking and metals and personal care products, occupational exposures, industrial dyes, and so forth. There was a significant increase in breast cancer related to environmental exposures. So again, this is something that we can control. This is something that when we are exposed to it can increase the risk for breast cancer by turning on that gene if we do have it. But with those who don't have a gene of breast cancer or a family history, it significantly causes damage to the cells, to your DNA cells, to the DNA of your cells, to the blocking and toxicity of the lymphatic system, the liver, and so forth, that over time can increase the risk for breast cancer. Even air pollution, by the way, is a big risk factor for breast cancer. Now, at the end of the month, we're going to talk about breast implants. And just to put it out there, the studies have been showing that breast implants do increase a risk of a rare form of lymphoma called anaplastic large cell lymphoma, but they haven't quite linked it to breast cancer directly. What we have seen is that with breast implants, there is an increased risk of mold contamination, and we know that mold blocks up the lymphatic system and can also increase the risk of breast cancer. Now, viruses. This is a fascinating topic when it comes to cancers and viruses. So in the past, viruses have been a big deal with many different cancers. We know, for instance, that the human papilloma virus, the HPV virus, is related to cervical cancers and head and neck cancer. So tongue cancer, throat cancer, it's often related to HPV. We know that cytomegalovirus can also be related to some of the head and neck viruses and brain tumors. We know that HIV, another virus, is related to Kaposi sarcoma. We know that Epstein-Barr virus is related to some of the lymphomas and leukemias. But we also know that there is infections like tick-borne infections, such as Lyme bacteria and Bartonella, that are related to certain cancers. So in 2010, there was a study that looked at Epstein-Barr virus and its direct relationship to increasing breast cancer by 68%. So if you do have chronic Epstein-Barr or you've had mono in the past, it is very important to get those levels checked and to connect with one of us doctors who is more versed in dealing with these chronic, low-grade, chronic infections and viruses that kind of burden the immune system, burden the lymphatic system, and set people up for these cancers. So get this checked out, ladies. Epstein-Barr virus is highly related to breast cancer. Now, in 2019, there was another study that basically confirmed the Epstein-Barr link, the Epstein-Barr virus link to breast cancer. But one of the other things that they found was this virus called the mouse mammary tumor virus, MMTV for short. What they found was that this particular virus was found in about 40% of the breast cancer cases in the US, and that the higher the socioeconomic population, the higher income population of women had an increased risk of the MMTV virus, and therefore also had an increased risk for breast cancer as a result. So what they thought this was due to was the fact that in the lower economic population, socioeconomic populations, that these people often are exposed to a lot more infections, and so they have a lot more immunity against a lot of these viruses and infections. Their immune system is actually on inactive mode. And so when we are in a higher socioeconomic population, then we are keeping everything clean and hygienic, and it reduces our immunity as a result. And when we are exposed to this mouse mammary tumor virus, which is something that is passed on from mice to adults or people, then our risk is significantly increased with breast cancer. So there is really not much of a test available for this MMTV right now clinically. I tend to test it energetically and hope that if we catch it, we can figure out a way of clearing it. They also found another virus called the bovine leukemia virus that is found in cow's milk in more than half of the breast cancer patients. So think about it. If you're a cow milk drinker or have been, you may have this BLV virus again, which increases the risk for breast cancer. So one of the biggest preventative treatments that you can do for yourselves right now is to avoid drinking cow's milk. Okay, yogurt tends to be a little bit different just because when we culture it and we heat it up, it tends to kill some of these infections. The components of breast cells, the yogurt changes, and so the breast cells don't react, the lymphatic system don't react as much to the components of the yogurt at that time. But if you're drinking just straight cow's milk, it's a risk factor. They found this even in the Australian-based cows, this bovine leukemia virus. So it is a worldwide virus that impacts the risk of breast cancer. One of the things that I want to point out is that is relatively a new discovery, is that there is a significant number of breast cancer patients that get breast cancer as a result of Bartonella. So Bartonella is known to be the cat scratch disease. You can get it from cats, but you can get it from a lot of different other animals and other people, insects, and so forth. Bartonella tends to typically cause swollen glands. And guess what? In the breast cancer, we often get swollen glands. It also can cause joint pain. It can cause unusual rashes, and it can cause fatigue. It can cause breast lump. Okay, so if you're a carrier of Bartonella and you don't know it, there is a significant increased risk for breast cancer. And it is, again, important for us, all of us females, to get checked for Bartonella. Now, again, the difficulty is that the Bartonella testing available is not as accurate as we like it to be. There is some tests from some of the specialty tests across the country that we tend to use to detect Bartonella, but if it is hidden in the tissue, sometimes we can't find it. And unfortunately, many of the breast biopsies that are done, they don't look for Bartonella, they don't look for Borrelia, they don't look for these viruses, and they don't look for mold or other infections. So ladies, we have to be our own advocate and really look to make sure that we are checked at least systemically for these infections. So Bartonella, cat scratch disease. If you have a cat, it puts you at a higher risk for breast cancer because of the cat scratch disease that it may be carrying, especially if it's an outdoor cat. So for my patients who have chronic disease or cancers, I encourage them not to have their cat, to give away their cat to somebody else who would love this cat as much as they would. But it is a big risk factor for cancers and infections like Bartonella. Okay, I feel like I'm talking a lot, but I'm going to go through just some basic stuff, unless you ladies have any questions for me. One other addition that I want to add to this whole panel of discussion is emotional baggage. A lot of times when we carry emotions that are deeply seated, suppressed, pushed aside, that it does put us at risk for breast cancer. Our breast tissue is really, if you think about it, is where as females we nurture, we give to others, we take care of others. And so when you have an emotional baggage that is burdening you, we need to clear that away. And we need to replace it with love for oneself and loving thoughts, and really leading that to being conscious of our thoughts, being mindful of how we're thinking and what our actions and behaviors are. Because all of that really links back to how cells function in our system. So one of the things that we need to do as when we love ourselves is to take care of this physical body. And that means that on a monthly basis, if you're menstruating, do a breast exam, usually around day 10, because that's where the breast is the least lumpy. And I usually encourage my patients to break up the breast tissue into quadrants. And so you cover each quadrant. So that way you're making sure that you're getting the full area of the breast check. You also want to make sure that you check right underneath the breast, the underarms. If you tend to have lumpy breast, fibrocystic breast tissue, then draw a picture of how big the lumps are and where they are, and check every month to make sure that it's about the same size and about the same location. That's why it's important to do it around the same day every month. Get regular dental care, okay? Dental care, remember, and my suggestion would be to always go to a biological dentist. The biological dentists are fabulous at figuring out what infections may be going on hidden that majority of dentists don't look at. We tend to do a lot of work with biological dentists, and we also do something called regulation thermometry, which is one of the imaging devices that we have on special for all of you for this month of October, and basically looks at measuring the temperature of every tooth, the lymph system, the breast, the abdomen, the gut, everything throughout your whole system. And then you undress and wait in the cold for about 10 minutes, and we measure the points again. And it's a physiological test. It's a test of autonomic nervous system. What we're looking at is to see if your temperature regulates at each area. And if it doesn't, if it's blocked, and let's say in the lymphatic system or in the tooth, we know that then there is an issue going on there that may be contributing to breast cancer developing. And so this is one of the routine tests that we do here at Holistique, is on a regular basis, at least once a year, have my patients do regulation thermometry to check the dental, to check the lymphatic system, to check everything and see if there's any hidden metals, any hidden molds, anything that may be hinting with the changes in the temperature that the system may discover. The other one that I often suggest in conjunction with mammogram or ultrasound is breast thermography. So I want to be clear that breast thermography does not replace mammogram or ultrasound. All of these different images show us different things. Breast thermography is not looking at masses. It's looking at risk factors. It's looking at inflammation of blood vessels. Certain blood vessel patterns, like ones that are coming together like this, will tell me that there is an increased risk of breast tumor formation, possibly. There is cancer cells that are being fed that we need to make sure it hasn't become something big. And so then I will more likely do an ultrasound and an MRI on top of the mammogram to make sure that we are getting the detailed information and not just skim through with the mammogram. Breast thermography also looks at patterns in the breast tissue that may indicate estrogen dominance. So many times if I've got inflammation with all the blood vessels lighting up, heating up through the thermography, then I can see if you're more estrogen dominant, and on subsequent imaging, is that dominance in decreasing, which will decrease your risk for breast cancer. If you have large, dense breasts, if you have breast implants, oftentimes it's very difficult to see hidden cancer cells in mammograms. And so I often tend to recommend to do breast thermography in conjunction with those imaging techniques so that we get a better sense of what may be going on. Now, I wanted to step back just a second. If you think about breast cancer is visualized on a mammogram or an MRI or ultrasound when it's about a centimeter big. But one cancer cells to become this big can take anywhere between 3 to 10 years. It's not a quick shift, okay? It's not that overnight you got cancer. This process has been going on for years. And the way cancer grows is by feeding itself blood vessels. And so this is one of the main reasons we use thermography to look to see if there is any inflammation that might increase your risk for breast cancer, is because thermography is looking at the blood vessel patterns that are coming into a cluster and possibly feeding something. and that could be a tumor. It could also be an infection, or it could be both. And so I do recommend breast thermography. The camera that you use to get the breast thermography is very important. There are many cameras out there that are not quite approved for adjunctive breast cancer screening because you can manipulate the images. And so we tend to have, I believe, the most sensitive camera on the market that was approved as an adjunctive breast cancer screening tool. And it's highly sensitive because it picks up inflammation in blood vessels, even small, like the size of a strand of hair, 11 feet away from the camera. So it's highly sensitive in picking that up. Mammograms tend to pick up more masses, as do ultrasounds and MRIs. Now, there is mixed debate about mammograms, whether that's a good thing or not a good thing, especially under the age of 50. The recommendation for having a mammogram for females under 50 has kind of been really wishy-washy lately in the last few years. And the reason is because there's been a few studies out of Europe that looked at possibly an increased risk of cancer as a result of what the mammogram may show. For instance, if the mammogram showed a possible mass and you had to go get a biopsy, or the radiation of the mammogram, or the squeezing of the breast, all of that may be a contributing factor to a slight increase in breast cancer risk. And these studies didn't find an improvement in breast cancer survival either. And so there has been some debate about whether we should be doing mammograms on a regular basis in women over 50 or under 50. Over 50, there is a little bit more case for having regular mammograms, that it might pick up those tumors a little bit better than under 50 years of age, or I should say menopause. Ultrasound looks at masses versus cysts. And depending on the angle of the ultrasound, you don't always get an exact dimension of the tumors. But if you do have a mass, then I always have you do a thermometry or thermography as well, along with an ultrasound, to look to see if that mass is a cyst, like a fluid-filled mass, or is it a solid mass. And then an MRI is often recommended for females that have definitely a family or a personal history of breast cancer or ovarian cancer. So that's kind of like the imaging portion. In terms of looking at testing that will indicate to us whether there is something underlying all of this that may be promoting breast cancer that we want to prevent, is looking at the hormones. And we've spent few lives on this hormone deal. Can't live with them, can't live without them, I always say. But it is really important to look at the hormones and to look to see estrogen dominance is a problem or not, if you're progesterone deficient or not, and look at the different types of estrogens. And you want to get more of the E3 and less of the E1 to reduce your breast cancer risk. Detoxification capacity is really important, how your liver is detoxifying. And we spent some time on the live last week going into detoxification of the liver and what that all means. And there's genes that can weaken the detoxification system of our body, and hence weaken the detoxification of hormones and other toxins, chemicals, and viruses, molds, and so forth. And so we want to look at all of that, especially if you have a higher risk in your family or within yourself, or chemical exposures, chronically ill, immune deficient. Looking at metals and minerals. Metal toxicity, I mentioned earlier briefly, is one of those big ones that can block up the lymphatic system. If you have a mouthful of amalgams, that will often release the metals, especially the mercury is so volatile that will release and land in the lymphatic system and can cause blockage. And over time, over years, and maybe even decades, cause congestion in that lymphatic system that can potentially become cancer later. So if you have a history of cancer or are fighting cancer, it is, again, vital to get the metals checked and do a proper detoxification of metal removal, the amalgam removal, along with IV therapy and other nutrient support therapies to make sure that your body's eliminating the metals that are getting released as a result of even the procedure. We talked quickly about emotional health, and the deepest emotions, the most negative emotions, the most lowest vibrational frequencies are those of shame and guilt. And if you can live a life without shame and without guilt, and that is a challenge for most of us, then, and you can elevate yourself to joy and enlightenment, then you've done like 80% of the work. And by doing that, you're raising the frequency of the cellular capacity to fight cancer, to clear out toxins, and to heal and to regenerate. So look at the emotions, work on the emotions. Maybe you need a third party to point out those blind spots for you, but also meditation, anything that you can do to release some of those deep-seated emotions. High fiber diet. So we're kind of shifting towards diet. High fiber diet has been shown to significantly reduce breast cancer risk. So high fiber diet means lots of vegetables, lots of legumes, whole grains. I usually recommend to stay off of gluten, dairy, and sugar, which brings me to this point of the fact that cancer feeds off of sugar. And it's partially because cancer cells have about 19 times more insulin receptors than regular healthy cells do. So when you eat sugar, sugar goes and binds to insulin and gets carried into cancer cells 19 times more than it will to your own cells. And this is one of the main reasons why it is important to limit your sugar intake, especially simple sugars like fruit juice and candies and processed foods. Anything that will turn into sugar like that, you want to eliminate it because you don't want to be feeding cancer cells. Stress, and I think a few months back we did a few lives on stress, but we'll probably end up doing it again. But what most of us don't realize is that stress can also increase sugar within our blood, which will feed cancer. And this is one of the reasons why high stress will increase your cancer risk, okay? So you guys, again, go back to your exercise, meditation, chewing your food, just some of the basics, getting enough sleep, so that you're calming down the stress within your body, you're decreasing the sugar in your system, and reducing the risk of breast cancer. Vitamin D deficiency, like we said earlier, is linked to breast cancer. So making sure that you've got enough vitamin D, maintaining your body fat, and using clean body care products, hair color, and all of that as much as possible. Sleep is important. So there was a Johns Hopkins study that looked at an increased risk of breast cancer almost 2 times higher in night shift workers. And so get to bed. Try to see if you can change your schedule so that you're getting to bed in a decent time and you're getting that melatonin exposure and release. That will help with reducing the breast cancer risk and also improving your immune function. So with that, I'm hoping that I got most of this. I'm sorry, Dr. Marion looks like she wasn't able to join us, but hopefully she will next week. We are talking about cancer as a metabolic disease next week. And so please join us at 12:15 next Thursday. And just remember to be mindful of your well-being, because the bounty of good health is the greatest of all gifts. I thank you for joining me. You are a blessing. I love you, and I thank you so much. Please take care of yourselves and spend this time, October, as a time for transformation, meditation, and love for yourself and for others. I'll see you next week. Take care. Bye-bye.